My name is Achih Chen. I'm the director of the Georgia Center for Facial Plastic Surgery. I'm also the chief of the division of facial plastic surgery at the Medical College of Georgia. My practice is exclusively devoted to aesthetic facial plastic surgery. Anatomy of the face is the most complex and it's the most interesting, and that's the first part that we're going to see of each other. So the stakes on the face are the highest, and so that's where I feel that the focus of my attention is best served. Well, the consultation process is really an educational process, both for me as a surgeon and also for the patient. So many patients come in and they know what bothers them. For example, they may be bothered by a jowl or some fullness in their neck, but they're not really sure of the procedures that may be involved that could help address these issues. And so it's an educational process for me to understand what's bothering them, and also an educational process for them to understand what can be done. And really, there's always a spectrum of procedures that can be suggested for the patients. I believe that people should come out looking, after their surgery, they should look natural. You should not be able to look at a patient after they've had facial plastic surgery, especially cosmetic facial plastic surgery, and know that they had surgery. They should just look great. And philosophically, that's my goal for every patient. While cosmetic surgery may be in the news and on TV, most patients aren't that open about their procedures. So we try to preserve everybody's confidentiality. So patients, when they come, they don't sit in the waiting area, they're immediately taken to a room, and we try to minimize the chances that they may even see another patient. Just the other day, I got an email from one of my patients, a facelift patient from several years ago, and just out of the blue, I hadn't heard from her for a couple of years, and she sent me this very short email, and she said, "My husband looked across the table from me at breakfast and said that I was beautiful." She felt that all of this made it worthwhile. Well, I live and breathe what I do. And every waking moment is related to my practice, how I take care of my patients' outcomes, and how my practice runs. Our goal at the Georgia Center is to be the leading edge provider of cosmetic facial plastic surgery.